audio record the meeting. And then as a backup, we're gonna record it on WebEx, but we're not live streamed. And we don't have kind of the normal video recording, but we'll do that. We should capture some of it from the video. So,
Okay,
so whenever you want to put your mic up and they'll, or your, they'll.
and the light will still come on.
Yes.
Okay. Is it Heather's fault?
Not putting on there.
Sorry.
Yeah.
Exactly. Guy in the state senator.
Oh, did you see that? Like 300,000 views.
He didn't have a shirt on. That's.
Morning, we'll call the May 2nd board meeting. Please rise for the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Welcome everyone to the county boardroom on this Tuesday, May 2nd. First order of business would be public comments. Mr. Workman?
Well, Mr. Chairman, I rarely have a public comment. But I got beer news up in Chanhassen, so we got a brand new brewery out there, More. It's actually in Chanhassen, but it's in Hennepin County. So for many of you who don't know, we actually have a piece of Chanhassen, several pieces in Hennepin County. Nonetheless, it's in the beautiful town of Chanhassen, Hackamore, over on the east side, over by Dell Road, a wonderful place, nice owners. But the standing brewery there, Chanhassen Brewing, won a really good beer award, the Brewers Cup competition, and Chanhassen Brewing won in the wood aged beers category, the Carver County Reserve. They're in Carver County, right there in downtown Chanhassen. But I just thought I'd shout out to a little beer. I can see the weekend. It's already Tuesday. And I'm thinking we can maybe go over there and have a beer. So anybody watching, let me know if you're down there. I'll come down and we'll chat about county government. It's exciting and it's sexy. Thank you, Mr. Chairman.
Thank you. Do we want to continue with the community announcements, or we can wait until we do the approval? Is there any other public comment? If anyone wants to speak to any issues? Hearing and seeing none, we'll move on then to the agenda review and adoption.
Mr. Chairman, I would move approval of the agenda as printed.
Second. Motion by Degler, second by Lynch to approve the agenda as presented. Any further discussion? Hearing none, all in favor say aye. Aye. Opposed, same sign. Motion carried. Moving on then to the approval of the minutes of the April 18th regular session meeting.
So moved.
Second.
Motion by Workman, second by Degler to approve the April 18th minutes. All in favor, excuse me. Any further discussion?
Mr. Chair,
Yes, Mr. Goodman.
I'd like to suggest a friendly amendment to include a totality of the memo that I submitted the last board meeting be included verbatim into the record.
With that, Mr. Metz, do you have any guidance for that? We have it on page 5 that it's currently in the administrator report.
Mr. Chairman, board members, if the commissioner who made the motion wants to make a friendly amendment, he can certainly do that, and the second would have to agree, and then it would have to pass. If it doesn't pass, then it would not be amended.
All right, thank you. All right, there's a motion on the floor. Is there a second?
I'll second.
Second by Workman.
Who made the motion? Okay.
Commissioner Uterman.
Just a little technicality. If I understood, County Attorney Metz, we'd have to take the original motion, which was made by Commissioner Workman, and the original second, which was made by myself. And that would have to be an amendment to that original motion.
Correct. Okay, so then Commissioner Workman, are you willing to amend your motion?
Yes, Mr. Chairman.
And then Commissioner Degler, are you willing to second that?
No,
I would second that, adjustment, Commissioner Workman's motion.
Okay,
That'll be him.
yep, so we have to, first of all, the motion by Commissioner Workman, second by Commissioner Degler, and then the amendment, which Commissioner Workman second. So the motion, that motion fails for lack of second.
So, Mr. Chairman and board members, so Commissioner Workman could make his motion his original motion, or he could withdraw his original motion and then somebody could make another motion.
Or I could amend my motion.
Yeah, you could amend your motion, which you just did. But you could, maybe you could do it again and try to get a second.
Well, as we would do in this situation on the House floor, Mr. Chairman, I'd ask for advice. Because I believe if Commissioner Witterman has a statement, no matter if I agree with it or I don't agree with it, he surely should be afforded the opportunity to have that placed in the official record. I'm not sure what the board might be, others might be worried about related to that. So I guess, Mr. Chairman, I'll withdraw my motion to approve the agenda.
I move to approve the minutes on April 18th, the regular session with the amendment to include the full memo as submitted to the board in the last board session.
Okay, and just for clarification, for you, Commissioner Workman, the full text of the memo is available.
Yeah, Mr. Chairman, I think I misspoke because I said I withdrew my motion for the agenda. This is the minutes, correct?
Correct.
So I withdrew my motion for the minutes. It seems Commissioner Witterman has a motion on the floor. I'll second.
Okay, so motion by Uterman, second by Workman to approve the April 18th minutes with the amendment to include the memo that was presented at the end of the April 18th meeting. Any further discussion?
Yes, sir. What's the issue here, Mr. Metz? We have the memo, people can still access the memo, but the whole text of it wasn't entered, or what exactly is?
Yeah, Mr. Chairman and board members. So at the end of the last meeting, Commissioner Uterman had asked that a memo be made part of the record at the end. And so in the board packet, there was a statement that indicated that Commissioner Uterman had entered into the record a memo addressing concerns about the use of certain funds, concerns, and that if anyone wanted that full text, they could contact the county administration. And so if this were to pass, what would change would be the full text in that memo would then be included in the minutes, which are just a summary of what happened. So this would not be a summary of that. And it would also be included in, I believe, in the newspapers, because we're required to publish that as well. That's the difference.
Any other discussion? Okay, so we have a motion on the floor. All in favor, say aye.
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 All opposed? Aye. Motion failed.
Motion to approve the minutes.
I'll second.
Motion by Lynch, second by Degler to approve the minutes of the April 18th regular session. Any further discussion? All in favor, say aye.
Aye.
Opposed, same sign.
Aye.
Motion carried. Moving on then
Mr.
to,
Chair, could I get a clarification? Was that a 4-1 or 3-2? 4-1, okay, thank you.
4-1. Moving on then to community announcements. Mr. Degler?
Yeah, Mr. Chairman, I'll start with, this coming Thursday is the National Day of Prayer. I think, although many of us attend different churches, I think the National Day of Prayer is something that we can all agree upon. And I think it's needed now in our country and in our county more now than it ever has been. So I would highly encourage everybody to participate. Some road closures. As the rain has kind of subsided a little bit, many of the county roads, all of the county roads, I should say, probably, are now open. State Road 41 is still closed, has nothing to do with the flood. Construction in downtown Chaska will continue for quite some time. So it's another way of saying, don't forget the downtown businesses with the road closure. Because they still are in existence and they need your support. The third item I'd like to mention is this is the sunny part of the week. Sounds like we could get some more rain maybe end of the week, but sun shining, you're going to see a lot of agriculture implements out on the road. So give them a little extra space. Some of the equipment is getting big these days. So, and they do go slower than most vehicles. So give them a lot of work. The farmers are trying to get through the field. They want to get off the road as quick as they can also. And the last thing I'd like to mention is yesterday, you might not realize it, but yesterday was Melanoma Monday. It's a disease that it's becoming more and more talked about. Most cancers happened for people in 60s and 70s. Well, melanoma happens as very predominant in people 50 and younger. Melanoma Monday happens 3 weeks before the National Safe Sun Week. Sun is the major cause of melanoma. So Melanoma Monday gets you thinking about what are the causes, what are the prevention of this disease. So take a look, be aware. That should do it, Mr. Chairman.
Thank you. Mr. Lynch?
Mr. Chair, I think what Mr. Degler just gave you some bad advice that yesterday he said it was Melanoma Monday, yesterday was May Day. That's much more positive. And I would like to point out that 123, you mentioned the county roads, is now open between Watertown and Mare. County Road 27 north of Watertown is now open. It was a dangerous situation for a family. Someone tried to drive through the water, and the water may not look like it's moving, but the car rode up and it was actually went into the ditch, and it was wind was coming into the windows, and then I don't know for a fact, but I heard that it was a mother with children. So then you had the process of getting them out, and the water is exceedingly cold. So thankfully, it wasn't an emergency, but no one was hurt as far as I know. And then also County Road 11 south of Carver, Jordan is now open. So with that, the water's going down. So hopefully we can have a normal summer.
Thank you. Mr. Uderman?
Mr. Chair, this weekend's a 15-year run for Mr. Webb. I think most people in the room know Mike Webb, the proprietor of Dunn Brothers in downtown Chaska. They're going to close their doors after 15 years. You also know him as the former mayor of City of Carver. If you talk to Mike, I think one of the crowning jewels of his time was the discussions that he's been able to host at the coffee shop, and his efforts to lead the charge for a project called Carver Crossings that we can now see. And the skeptics of that project brought some information that hasn't come to fruition. It's been a great asset for the community, and I think that they're pursuing another building. But congratulations to Mike Webb on his time and service. Certainly doesn't agree with everybody and makes room for those conversations. So wanted to mention that. Had a chance to participate in Dia del Nino on Saturday. Close to 1,000 people were present at La Academia School as part of District 112 in partnership with Public Health. I'm looking at you, Dr. Scott. And it was a cool place for community to come together. We were coming out of the Twins game. I mentioned it to my daughter, and I said, "Would you catch the tail end of it?" And she's like, "Why did we even go to the baseball game?" She wanted to go see the dancing and the interactions and whatnot. The celebrations continue. Cinco de Mayo. There's a nice Rotary event on Thursday, Cinco de Mayo the 5th. It's much more than just margaritas on Cinco de Mayo. So plug into that as well. Coach Seifert, after 16 years of high school basketball, has announced that she's done at Chaska. So thank you to her for all that she's done and the lives she's touched. I don't know what the total count is in D1 athletes, D2 athletes, or D3, but lots of wins in 16 years. So shout out to her, and I think that kind of bleeds over. We've been in the softball fields a lot in the last couple of weeks. A lot of parents, coaches, and kids in sports and activity full force. The sun's starting to come out. A lot of commitment on those fields and a lot of interactions and conversations, making our community better in those team sports. Got invited to and decided to participate in Run 100 in May. This Chaska Community Center does something. If you run 100 miles, over the course of May, you get a fancy piece of swag, and so that's about a 5K a day for the whole month. And so we're 8 miles in. I know that Commissioner Fahey will probably put in more than 100 miles this month, but it's going to be a stretch for me to get to 100. So here we go. Also participating in 555, 5Ks over 5 months in Chaska, and then the park run. Everybody's invited to come every Saturday down by the courthouse right here at the Government Center. It's an out and back, 3.1 timed, and it's free. Had a chance to meet somebody there that was promoting the Memorial Murph workout. I've never heard of the Memorial Murph workout, but I'm told that the Memorial Murph workout is scheduled for May 27th in Chaska. Includes a 1 mile run, 100 push-ups, 200 chin-ups, 300 squats, a mile run, and typically carrying a 20-pound vest. And so this gal was very passionate about veterans and what they're doing. And it's not just 1 or 2 days a year, but it's every day. And so it's cool to see these things happening in our community. Commissioner Workman mentioned Hackamore. I can personally speak to the fact that it's an excellent brewery. I hope to see many of you there. And then 2 more things. Last week, I had a chance to participate with about 100 developers in the Minneapolis Metro, along with a handful of economic developers from Carver County, an event that Greater MSP hosted. And the purpose of this event is to bring those developers together to create long-lasting relationships and attract new and expanded business in the Minneapolis Metro. I think Carver County's on the map. We actually have 1 live promotion right now, a company that's looking to come here. If it came here, it'd be worth over $100 million. And so those are the types of relationships they take over and over and over and over again in an investment that we've made. And then finally, get invited to and had a chance to tour the Family Resource Center in Shakopee last week. And I know there's been some local community buzz around it, but if you get a chance to, if you haven't already, to check out what they're doing and what the point of what they're trying to do, it's more or less intended to be a one-stop shop for people that are in need, so they don't have to go to 6, 7, 8, 9 places. And so it was eye-opening to see it. I know that Shakopee and Scott County is taking steps in that direction to fund it, encourage it, and it was cool to be on campus. Light attendees on the Tuesday afternoon that I was there, but they say they pick up on Thursdays and Fridays, and it's just a stone throw away from the new cat building. So it might be worth a tour to go out there. So with that, thank you.
Thank you. Mr. Workman, anything else to add?
No, Mr. Chairman, I'm all out. Thank you.
Thank you.
If I could, Mr. Chair, I'd like to point out that Commissioner Uterman mentioned the Murph workout. It's named after Lieutenant Mike Murphy. It's a Navy SEAL killed in Afghanistan, depicted in the movie and the book Lone Survivor.
Thank you.
It's just mentioning May. Christmas in May is happening this Saturday. Christmas in May is it's a Chaska project where they take different local projects and take the time, volunteers, and fix it up. It could be yard work, it could be putting a deck on, could be doing a lot of different things in these houses in the city of Chaska. So if you have some time, it kicks off at 7 o'clock at St. John's in the gym. It used to be over in Guardian Angels, but that gym is currently being occupied. So now moved to St. John's in downtown Chaska. But Christmas in May, like our pastor said, if you're handy with a hammer, come and help out. If you even know what a hammer is, come and help out. So, show up Saturday morning.
Thank you. Financial assistance specialists are available at the NYA library the second Tuesday and the fourth Tuesday of the month, and also the Watertown Library. The specialists are from Carver County Health and Human Services, and they can help you with your current assistance benefits with SNAP, cash, healthcare, and applying for other benefits and just answering general questions. So please reach out to Health and Human Services if you'd like to get some of those assistance. And then the NYA West Carver Lions Club will hold its spring plant sale on Saturday, May 13th, rain or shine, and that will be at the Home Solutions parking lot. And over the weekend, I got the opportunity to enjoy some pork chops at the Carver Lions, and then went to the Cologne Fire Department Steak Fry, and then attended polka mass and breakfast at the West Union Church. So it was a great weekend, and since I was cooking all weekend, my wife was very happy with all those choices. And then, speaking of running, I just purchased a new pair of running shoes, and my wife is just utterly amazed at how many pairs of running shoes I have. So,
Now you gotta use them.
right? I've been using them, yeah. Okay. No more community announcements. Moving on then to the consent agenda.
Mr. Chairman, I would move approval of the consent.
Second.
Motion by Daigle, second by Uterman to approve consent agenda as presented. Any further discussion? Seeing none, all in favor say aye.
Aye.
Opposed? Same sign.
Mr. Chair, I want to abstain. I have a family member on one of the items.
Yes, that is correct, Tim. That was number
5.17.
5.17. Okay, so we have a motion with Commissioner Lynch abstaining. All in favor, say aye.
Aye.
Oh, same sign, motion carried. Moving on then to agenda item 6.1, the presentation and proclamation of May as Mental Health Awareness Month.
Chair Fahey and Commissioners, staff, I'm Dr. Richard Scott. I work as a Deputy Division Director for Health and Human Services, and I have the pleasure of overseeing both our public health and behavioral health departments. So I really appreciate this opportunity to have a short presentation and a request for approval of a proclamation acknowledging that May is Mental Health Awareness Month. As many of you know, through the last 3 years, we've been through a lot of difficulties with the COVID pandemic. Even prior to the pandemic, I just read this morning, woke up, my wife showed me this article because I mentioned I was presenting today on this, and she said, here's this article, says 1 in 2 of us have experienced loneliness even before the pandemic, and that loneliness sometimes can be habitual and lead to other really concerning issues. And obviously the pandemic has exacerbated that. So this opportunity to bring awareness to that, we really appreciate. And I have the honor today of recognizing one of my colleagues who'll be doing the presentation. She's the smart one of the 2 of us, so I've asked her if she'd be willing to give the content, and I'll wrap up with requesting approval of the proclamation. But just a brief bio, I think this is the first time that Stephanie Combe has been here in person to present to the board. Many of our listening audience may not be aware of her, so I'd like to give her a brief bio on her. But Stephanie B. Combe, she's our Behavioral Health Clinical Services Manager. She has a Bachelor's of Arts from the College of St. Benedict, a Master's of Social Work from the University of Nebraska at Omaha. She's licensed by the Minnesota Board of Social Work as a licensed independent clinical social worker. Her work experience is varied. She started her professional career as a social worker for the Chippewa County Family Services. Following graduate school, Stephanie has worked in psychiatric hospital settings for adolescents and 2 large nonprofit organizations serving early childhood, youth, and adults in both direct service and leadership. Stephanie joined the Carver County as the Behavioral Health Clinical Services Manager in 2021. She has been a tremendous asset to our department, not just our behavioral health team, but across the county. She frequently provides leadership with our HHS manager team. She's a joy to work with, and it's just an honor to be able to have her present today on the state of behavioral health, the state of mental health here in Carver County. So with that, I introduce Stephanie Conley.
Thank you, Richard, and welcome, Stephanie.
Thank you, Commissioner. Mr. Chair and Commissioners, I'm really grateful for the honor to come and speak with you today. And mostly what I want to say is I'm honored to speak on behalf of the amazing staff that we have at Carver County who work every day on behalf of the mental health of our community members. So, just want to make sure. Okay, I'm good. Okay. So why are we here talking about mental health, and why do we spend a month trying to raise awareness about mental health? So, first of all, I've been saying for a while that one of the unfortunate gifts of the pandemic is that we've all learned a lot to talk about mental health, and it's certainly much more in our awareness. Obviously, people with mental wellness are able to engage fully in healthy relationships. They're able to participate in their different life stage activities, whether it's going to school, participating in work, being active members of their communities. The other thing is that mental health is health. We often think of it as, we try to separate our head from the rest of us, and that's not what it is. We know that untreated mental health conditions have a negative impact on our physical health. We also know that sometimes adverse physical symptoms can increase our mental health symptoms. Treatment for mental health is effective and can ease the challenging symptoms, which that is a really important message for people to understand, especially people who might be reluctant to engage in mental health services. And then every year there's advancement in treatment options. So we have come a long, long way from, in the last 50 years in treatment of mental health. So these are just some statistics from NAMI, which is the National Alliance of Mental Illness. They do a lot of tracking and data, and also are one of the leaders in our nation around raising awareness about mental illness. And these statistics are on their website, as are many others if you're interested. It's NAMI.org is the source. So we can talk about, 1 in 5 adults experience mental illness each year. 50% of lifetime mental illness begins by age 14, which is the reason that we should be actively paying attention to our young people and seeing where we can intervene early. And then another statistics that still is very shaky for me is, causes me a lot of concern, is that suicide is the second leading cause of death among young people aged 10 to 14. And that's astounding and sad. So why are there unmet mental health needs? So there's what I call both systemic barriers to access and societal barriers. Currently, our systemic barriers of access, one of the major ones, which we are absolutely experiencing here at Carver County, is a workforce shortage of prescribers, therapists, and psychologists. And what is happening in our community now is that is leading to intense competition among our employers. Currently, the ratio of providers in Carver County is 1 provider for every 470 residents, which is a little bit lower. The ratio is, I don't do ratios very well. We don't have enough mental health professionals in Carver County, and we have fewer than in the rest of Minnesota. So what's impacting that? For one, mental health has been a challenging business to get into and stay in for a long time. We currently have challenges with reimbursement rates remaining very low. I'll just share one statistic. Last fall, I did a little bit of a look back to 2014 to 2021, and I looked at some of our most common services that we bill. And for example, in our day treatment program, the rate had increased by 0.62%, less than 1% a year over those span of years in our day treatment rate. Several of our services have increased by about 1.78% per year. So obviously it's not keeping up, even with basic inflation, much less the cost of all the things that we're supposed to be doing for those rates. And I believe as part of our initiatives last fall, when we were asking about legislative initiatives, that was one of the things that we brought forward to all of you. We have compliance requirements from the state of Minnesota that add complexities and necessitate more administrative oversight. There's right now a lack of a comprehensive continuum. And I'm going to show you in a bit our continuum of care that we have in Carver County. And I would love to tell you that we can serve every need that we have in Carver County and in the state of Minnesota. But what we're finding is that we have gaps in care. And most of the time where the gaps come in is in places for specialty care. For example, somebody who is elderly and has medical complications related to aging, but also needs mental health services. That's a gap in our services. We have diminished services for those with disabilities or high behavior needs. So our crisis team, which is operating 24/7 on behalf of the county, one of our activities that we're frequently doing is trying to help find hospital beds for those who are in need of moving out of the emergency rooms. Over and over again, what I hear from the staff is that the gaps are strong and high for those people who really need kind of the specialty care. And then there was a recent statistic that said, I believe it was last week, the number of people boarded in emergency rooms waiting on a mental health bed placement exceeded the number of people waiting in emergency rooms for med surg placement, which is significant. So we have a significant issue in our community. And then finally, there's a lack of culturally and linguistically specific providers, which for serving our communities where they might be of certain immigrant populations or certain communities of color, that presents a significant barrier in terms of their comfort in accessing and getting their needs addressed. So the next thing we talk about is societal barriers to access. So mental health stigma continues to play a role in delaying or preventing people from seeking help. Our insurance limits access to the full continuum of services. So I believe I was speaking with Commissioner Degler last summer at the fair, talking about our Steiner-Kelting facility and why isn't everybody able to just get into the Steiner-Kelting facility. And one of the challenges for Steiner-Kelting is that the service that it bills under is often not covered by some of our commercial insurance plans. So that's just a very concrete example here in our community. Our high-risk groups face additional barriers to access. We continue to have people who experience a fear of job loss or ostracization if they're identified as having a mental health need. Work, school, and social settings may not be mental health informed. And I just want to talk a little bit about what I mean by that. Being mental health informed is understanding mental health symptoms and being able to make minor adjustments to support somebody who might have a mental health need so that they can do their work well. A common example is somebody who's experienced a lot of trauma, for example, would not be able to stand where I am right now with their back to the door. Because people who've experienced trauma often have a hypersensitivity to their surroundings and would feel a threat to have their back to the door. So simply being able to have a view of the door can be often help reduce their trauma symptoms in a work setting. Another example, and we see this a lot with people with ADHD, would be people who are struggle to concentrate. They might need a little bit of adjustment in their environment so they can stay focused enough on their task. So those are just a couple of examples. So Carver County, we work really hard to have a gold standard. One of the things that I appreciate about Carver County and why I came to Carver County is because Carver County is still small enough to we get the chance to know each other and work together closely, but yet it's robust enough to also provide a fair amount of services within our community. And that's a pretty significant sweet spot. We have committed staff who serve our clients in multiple ways. And I want, we always think about our therapists and prescribers, that's great. But there's also people who serve at all levels, including the people who answer the phones and greet people with a welcoming voice, and people who help with navigating insurance and other things. We have school districts who have really embraced school-linked mental health, and Carver County was one of the early adopters of school-linked mental health services, which is now spread throughout the state and is robust within the country. We've recognized the importance of intervening there. We have community members who step up and participate in activities and help guide us. We have strong partnerships with our community providers, with RMC being just one of them. And we have a broader community awareness of mental health and how it impacts our businesses and faith communities. It's really neat to hear from business owners and people from faith communities who say, how can we support our people a little bit differently? And finally, we have innovation, and we look for ways to meet the needs of people within our community, which is a really strong. So this is that continuum of care that I was talking about, and I'm going to ask forgiveness for the very small print, but it was really hard to put our full continuum on one slide. The areas that you will see in bold are the areas that Carver County provides those services directly, and then the other areas are areas that we would engage with partners. You can see from how much bolded that we actually have a fair number of services across the continuum, and I think it's important to recognize both the early intervention services that our staff in many areas are providing, as well as the more intensive services that we are able to provide. I'm not going to go into all of those just because that would have me here all day. That wasn't on the agenda. So what do we do next? All of us are responsible for our communities. And so these are just my ideas, but one of the things I say is that we continue to work closely with our community and regional and state partners to address gaps. I see that as my role to be paying attention to where our gaps are and how, what are the policy changes that we need at the state level so that we can continue to do our work. And we all have roles in our work. We stay visible, innovative, and responsive to community needs. We work with our policymakers and third-party payers towards mental health parity, especially as it relates to sustainability. We continue to invest in our teams to ensure they have the training, support, and other resources to provide the best care that we can. We improve our ability to provide services to those groups who are at higher risk of poor mental health outcomes. We encourage our young people to consider careers in the mental health field. This is a big one. If you have young people in your life, please encourage them to consider this as part of their career path. And then we keep working to address any stigma related to mental health. The next is the proclamation request, and Dr. Scott.
Thank you, Stephanie. I appreciate that. Chair Fahey, Commissioners, again, thank you for this opportunity to present on the importance of mental health in our community. Obviously, something that we're concerned about and address every day. And just May is that special month that we want to have the community sort of pay particular attention to the concerns there. And so with that, we're also here to request approval of a proclamation declaring May as the Mental Health Awareness Month. And I would like to just briefly do that. You do have a copy of it in your packet. But today is May is National Mental Health Month. And whereas mental health impacts the health and well-being of our children, families, schools, businesses, and the communities, and whereas the COVID-19 pandemic and current economic conditions have exacerbated the stress, trauma, anxiety, depression, suicide ideation across our communities, making mental health awareness and the provision of the services more important now than ever. Whereas 1 in 5 adults and 1 in 5 young people between the ages of 13 to 17 years experiences a mental health problem in any given year. And whereas suicide is the second leading cause of death for U.S. children ages 10 to 14 and 11th leading cause of death across the nation. And a higher percent of older adults, age 65 and over, commit suicide more than any other age group. And whereas it is critical to increase the awareness and knowledge of mental health problems and how to get help when it is needed, and whereas early identification and treatment are vital to the prevention of suicide and successful management of mental health problems and recovery. And whereas every citizen and community can make a difference in helping end the silence and stigma that surrounds mental illness and discourages people from getting help. And whereas public education and civic activities can encourage mental wellness and help improve the lives of individuals and families affected by mental illness. Therefore, be it resolved that we, the Carver County Board of Commissioners, do hereby acknowledge the month of May 2023 as Mental Health Month in Carver County, in honor of the dedicated professionals who work to create a safer and healthier community in Carver County. Thank you.
So moved, Mr. Chair.
Second.
Motion by Lynch, second by Uterman, to proclaim May as a Mental Health Awareness Month. Any further discussion?
Mr. Chair,
Yes, Mr.
I
Uterman.
don't know if this is if we're gonna have more chat about it, but since you guys are in the boardroom, I just feel we need to take a little bit of time to say there's so many things you guys are doing that couldn't be included in a 15-minute presentation. And a couple of those things, the surface level seems super easy and simple, but we do parks really well. And the benefit of parks and spaces for people to get outside is an area that we excel in and we can contribute to. The efforts within the co-responder, it's not clean and easy because it's so hard to find the right talent. Where does it sit and all the funding sources? But I think we're one of the leaders when it comes to co-response in the space, not just talking about it in the rhetoric of a headline, but we're actually doing it. And Dr. Scott, your team's efforts to lead communities and belonging, these times they are changing. And I use one data point that 20 years ago, as a marker in time, there was 2% people of color in our community. And now my second grader comes into a kindergarten class of 27%. That creates a different cultural vibe than used to in 150 years in Carver County. And so it's not lost on me. I also wanted to mention that, some of these problems and challenges aren't ours. So maybe we should consider about a legislative priority to make this a focus. And I know it is at the state level. But what are those things that we can do locally? And I keep hearing a recurring theme a number of times. One is beds. We need more beds. There's no beds. We don't want to build something for beds here. Where do they go? And it has such a ripple effect. And a lot of people in the room right now are impacted by it. Attorney Metz and his team and the things that they have to do in response to some of these things. The sheriff and the sheriff's office, our partners at Ridgeview, and where it could be a 3-day stay, it extends to be 10 or 12 days because there is no additional beds. And so it's real. And I hope that this becomes an elevated priority of our board for investment and prioritization. And I'll back to a comment that you make, Dr. Scott. A lot of times this is paint by number. And if you got to look at it in sequence, everything. And so I hope our conversations lead to where the highest impact that the board can get behind supporting what is next. And I think one of those areas, I'd love for you guys' comments. I think one of those areas is I think we do well in emergency response, but what happens after that patient or that client or that individual is released? We have a personal family example, extended family, where it was, come get your kid and there's no owner's manual. I remember what it was like bringing our kids home. We didn't get an owner's manual. Nobody told us what to do, but that's the feeling of some of these parents after their kid or family member goes through an episode. And it's like, good luck, knock yourself out. And there's not a lot of resource for the family to support them post episode. And so appreciate the work that you're doing. I hope that becomes a focal point in conversation in June when we have our strategy session. And I know your team's working hard. We can't even fully appreciate all the things you guys do on a regular basis. But Carver County and our affluence and our education and our healthiest and happiest and all those things, we're not immune to this. It happens here too. And we have the luxury of a lot of resource that other communities don't to prove and pilot and do these things. So thanks for the efforts. It's not just May, it's a lot and it's near and dear to me. I appreciate you guys. Thanks.
Any other comments?
Yeah, Mr. Chairman, there was a question I was gonna have. It was mentioned that one of the problems that we have with mental health treatment is the low reimbursement. Where does that fall? We're talking state or we're talking federal?
Commissioner, I would say it's both. It's Medicaid reimbursement rates that do not keep up, and there's also the challenge of reimbursement through our commercial clients. It's just not reimbursed in the same way, and that's been part of the mental health parity push to try and have it recognized in the same way.
I just want to make sure that people that listening to this would understand that. You mentioned it, but you kind of glossed over it, so I want to make sure it's a compensation. It's not only the state, but it is also the federal compensation. I want to thank you for mentioning the Steiner Wellness Center. We do have that in Carver County, which a lot of counties do not have. But another thing that was on the consent agenda today was the crisis center. We approved that. Explain crisis call line. And what number can people call to get immediate help?
Thank you, Commissioner. The mental health crisis line is our state mandated crisis response team for Carver County, and we also serve in Claude County. The local crisis number is 952-442-7601. We are also one of the 4 regional providers of the 988 call centers for the state of Minnesota, and that number obviously is 988, which is a lot easier to remember than what the number was previously. So we're honored to be providers for both of those resources, and honored to be able to serve our communities in that manner.
Just out of curiosity, there's no acronym for that phone number, like Think Safe or something?
Which I'm sorry,
The local number, the
local number?
952.
No, sorry,
Something to work on. Okay.
thank you.
Any other questions or comments? Mr. Lynch?
Yep, only that, one thing we need to concentrate more on is you see the suicide. That was actually new stat for me that I didn't know that, people age 65 commit suicide more than any other age group. It's very disconcerting, and, sitting in the mental health advisory committee, we said, have conversations like this all the time, and, Heather and her staff does an absolutely wonderful job. They work with the sheriff's office, all our deputies are trained in de-escalation, and they have a mental health specialist embedded with the sheriff's office, and does absolutely wonderful work in de-escalation and a lot of things that don't make the news. So that more than happy to make this proclamation.
Any other comments? I just have a two-part question for you. Stephanie, on the first slide, you had mentioned that every year there are advances in the treatment options. If you could just share some of those new advancements of that treatment, and then also you talked about the innovation, looking for ways to meet the needs of the community and how you're doing that.
So I use that as a general term, that there's advancements. Most of the time it's advancements in medication, but it's also, there have been advancements in our understanding of the brain and the impact of certain events on brain and our functioning, which is where our mental health starts. We've also, there's been advances in recognizing the importance of addressing trauma in a very, not letting it just sit and not be addressed, but the importance of addressing trauma in our communities, especially as soon as we can after the trauma, which has shown, some research has shown that when you do that quickly after the trauma, the long-term impacts are decreased. I'm not a mental health researcher. I would defer to my colleagues in the Harvard and all those other places that do that, but we've certainly made a lot of progress from, even 50 or 60 years ago, when a lot of people with significant mental health issues would have been institutionalized. And now we have very many treatments that are available and are able to support them.
Thank you. With that,
Any question?
yep, we do have a motion on the floor. All in favor, say aye. Aye. Opposed, same sign, motion carried. Thank you, really appreciate what you do and all the hard work and good work. Okay, moving on then to the county administrator.
Yes, thank you, Mr. Chair. Back to Commissioner Workman's topic of beer at the Shram House on Thursday at 4 o'clock. This is a groundbreaking for West Creek. That project, you may recall that from like a long time ago. A year plus ago, we talked about that here, provided some funding. Who's all planning on going to that? You have a calendar invite, it's on your agenda.
I am going to be attending a part of it.
Couple of you, good to have some representation there. And it is publicly noted. And then, big change of gears, next Tuesday, no board meeting, but we're gonna visit Morgan, County. Who's planning on attending that one? All of you? Okay, all right. We'll see you
How
there.
are we getting up there? Meeting up there?
Yeah, own personal vehicles going, ride share, great.
Is Mr. Metz coming, or you've been there already many times?
I've been there a number of times. You really enjoy it, and they do a really nice job. It's really state of the art. I don't call it more, but
A medical examiner building tour.
I don't hype it up by saying you're gonna enjoy it. Medical examiner's office, correct. Thank you. Then the foster care banquet, 5:30, that same night. We usually have Gail in attendance. If you can go.
I'm going to be there, yes.
Very good. That's it?
Mr. Chairman, I did ask the medical examiner, forget her name, lady, a couple of years ago about the myth about Should you wear proper undergarments just in case you meet an early demise and end up on a table in front of her? And she said, absolutely. It's absolutely true. You should definitely.
Your mother was right.
That's right.
That
She
was
said
my-
yes.
With that, I've always heard it really doesn't matter, because first you see the accident gonna happen, first you say it, then you do it.
Are we going to close
Yeah,
that?
we are going into a closed session. We need a motion to go into the closed session.
So move, Mr. Chairman.
Second.
Motion by Dagler, second by Lynch. Any further